Hello, my name is Lena Santos. I am a student at EKU in the Psychiatric Mental Health Nurse Practitioner program. Today I will be presenting my evidence-based project proposal titled Taking Meds to Release Those Dreads. This project proposal addresses the healthcare problem of medication non-adherence in adult patients with mental health illnesses. According to the U.S. Department of Health and Human Services in 2014, patients who do not comply with their treatment for mental health illnesses are at high risk for many unhealthy and unsafe behaviors, including alcohol or drug abuse, violent or self-destructive behavior, and suicide. As a result, these negative behaviors can lead to hospitalization, incarceration, or death. The purpose of this project proposal is to implement a multidimensional intervention program to improve medication adherence rates from pre to post program in adults with mental health illness. The multidimensional intervention approach can be best applied by the advanced practice nurse in a mental health outpatient setting. The outpatient clinic setting serves as a facilitating liaison for the transition of the acute patient back to the community to ensure they have the appropriate resources to improve their adherence to treatment and thereby improve their health and well-being. Multidimensional intervention focuses on psychoeducation, motivational interviewing, or MI, and/or cognitive behavioral therapy, or CBT, with pharmacologic treatment, and has been studied to improve medication adherence rates. 4 studies implementing multidimensional intervention were critically appraised to support the problem. Study 1 by Polly et al. In 2015 demonstrated that multidimensional and intersectoral intervention significantly improved medication adherence up to 3 months after discharge in patients with psychiatric disorders. Study 2 by Pakpour et al. In 2017 demonstrated that multifaceted intervention significantly improved medication adherence and clinical and functional outcomes 6 months after intervention in patients with bipolar disorder. Study 3 by DeHaan et al. In 2016 implemented integrative interventions that demonstrated significantly higher adherence scores in the experimental group than the control group after 6 months in patients with schizophrenia. Study 4 by Dekek and Kutlu in 2016 implemented adherence therapy that demonstrated significantly improved adherence scores after 7 months in patients with schizophrenia with a history of low treatment adherence. The project proposal will commence as follows. Step 1 will be to identify prospective participants of patients enrolled in the outpatient program at Monte Vista Hospital. Step 2, recruit participants using posters, flyers, and verbal scripts at patient check-in. Step 3, conduct individual orientations explaining the project and intervention with the interested participants and their family members or support systems. Step 4, obtain signed informed consent. Step 5, obtain completed baseline medication adherence report scale questionnaires, or MARS for short, from the participants. Step 6, assign participants to participate in all 4 components of the outpatient program, any 2 days of the week for 2 to 3 hours each day for a total of 6 months. The 4 components comprise of the multidimensional intervention, including psychoeducation, MI, CBT, and pharmacologic treatment. Step 7, participants will be required to sign in and out with their names and times to track their therapy participation, and medications will be tracked using the facility's medication administration record. Step 8, data will be collected from Step 7 on a data spreadsheet weekly by the principal investigator. Step 9, MARS questionnaires will be completed by participants at baseline, 4 weeks, 12 weeks, and 24 weeks. And finally, Step 10, a post-program interview will be conducted along with the post-program MARS questionnaire to compare to prior MARS scores. The medication adherence report scale will be used to measure adherence rates. The MARS is a self-reporting tool based on medication taking attitudes and behaviors. It has a total of 10 questions. Each question is scored by a positive or negative response. 1 point is added for every positive response, and 1 point is deducted from every negative response. Scores range from 1 to 10, with higher scores indicating more adherence. This concludes my project proposal. Please feel free to email me with any questions or comments. Thank you for watching.